Good morning, everyone, and good morning to my fellow Minnesotans. As we're facing an unprecedented health and societal event, I have the absolute confidence, as always, that Minnesotans come together. They're there to help their neighbors. They're there to do the right thing. I'd also like to say a thank you to all of the public and private sector healthcare workers and the folks working to ensure that Minnesotans are doing everything possible to stop the spread of COVID-19, to treat those once they're infected, and to make sure Minnesota is doing our part in bending that curve so that our healthcare system is able to absorb the incoming numbers of people. We met a week ago Sunday. We had 2 cases of COVID-19 in Minnesota. Yesterday we had 21. Today we will be announcing we have 35, 14 additional cases. We are doing everything possible with the community mitigation strategies that we put out on Friday, making sure we have moved through the Executive Order 20-01, that the authorities granted to the administration are being used, but also that we're following the Minnesota Department of Health and the best practices to ensure people are not gathering in groups of 25. We're practicing social distancing. We're preparing to allow people to work from home, and we start thinking about and strategizing what goes forward. While children have proven to be less vulnerable to this virus, we haven't seen significant spreading in our schools. We do anticipate that COVID-19 will have a sizable impact on our education system in the coming weeks, months, and potentially the coming year. We cannot wait until the pandemic is in our schools to figure things out. That's why Executive Order 20-02 that I just signed will begin the process of closing our schools starting tomorrow. Schools will be closed by Wednesday through the 27th of March. This time period is to allow our school districts to adapt, to prepare for distant learning, and to do the things that we need to do that are multifold when a decision like this is made. And I want to be very clear about this. A decision to close school has a magnitude of consequences that will change life in Minnesota as we've seen it operating. And I say that because we have to take in all of the considerations that will go into this. And as you heard on Friday, one of the considerations is providing childcare for our healthcare and emergency services workers. And that's why this executive order and is part of the planning process. And at this time, I'd like to just take a moment to thank all of the people in state agencies, especially Commissioner Ricker and the people at the Minnesota Department of Education, that we have thought this through. And I will be willing to say at this time that we have the most comprehensive plan for what school closing looks like of any state in the nation. And you are going to see it and be addressed to it in just a few minutes. But for the Minnesotans out there thinking about this, it's not just the child care for those emergency workers. It's how do we prepare for distant learning? How do we take into consideration the lack of access to broadband in all corners of the state? Care for children with family of emergency workers, nutrition, meals and instructional material pickup and how we will deliver it, mental health support resources, special education services for IEP and 504 plans, English language learners, tribal considerations, libraries, activities, all of the things necessary when a decision like this is made, and the ripple effect and the impact it will have on families and on Minnesota. Those things will be laid out, and we are prepared over the next 2 weeks to start preparing to be able to deliver all of that. We will immediately start, and there will be local school districts making these decisions as early tomorrow, but the executive order and the expectations is that our schools will be closed for preparations. No students will be in class after Wednesday. Everyone at this time, and this is what we're asking for, the cooperation and the help. If you're wondering what you can do, first and foremost, follow Minnesota Department of Health guidelines. Follow the guidelines we're putting out. Decide where, and there will be an orderly way for us to be able to do these things. I think we all recognize our food pantries are going to need help. There are going to need to be volunteer opportunities to help our fellow Minnesotans. Those opportunities will start to arise over the coming weeks and months, and if we pull together, that's as we always do, we will be able to ensure both safety and security, bend the curve on the spread of COVID-19, and at the same time doing what our responsibility is, deliver a high-quality education. And I want to be very clear, the equity and access issue is critical. We already have gaps in our delivery of services in communities of color, and we are deeply conscious of a decision to close school can have disproportionate impacts on certain communities. That's why planning and planning diligently, as you're going to see, is exactly what we need to do. Over the last 48 hours, I've spoken with countless education leaders, parents, business leaders, 77 of our health systems CEOs and leadership, and my predecessors in Governor Pawlenty and Governor Dayton, looking for their insights, their guidance, their thoughts that would be there. The one thing that has become abundantly clear to me is Minnesotans pull together in time of challenge. Minnesotans care for their neighbors. Minnesotans plan and prepare as well as any people, and we are prepared to take this head on. And with that, I'd like to turn over the microphone and the podium to Commissioner Mary Catherine Ricker of the Minnesota Department of Education to go into a little more detail about what this means. Commissioner.
Thank you, Governor. Thank you so much, Governor. Good morning, everyone. Thank you so much for coming. Our top priority is always the safety and security of our students. The Minnesota Department of Education has been working very closely with the Minnesota Department of Health to get information out to school districts, charter schools, as well as our partners in education in the independent school community about COVID-19. I want to thank Commissioner Malcolm and her staff for the wonderful partnership and leadership over the past few weeks. She and her team have been professional and helpful every step of the way as we work together to support our students and families and school communities. I also want to thank my colleagues from the North St. Paul Maplewood Oakdale School District for standing with us today. Superintendent Christine Osario and Union President Rory Sanders. And I also want to thank my colleague, Deputy Commissioner Heather Mueller, who is a tireless project manager for our school closure guidance and our school planning kit. And thank you for being with us today. Additionally, the governor and I, as teachers, also want to assure that our students are continuing to receive the equitable education they deserve. Whether a student is a kindergartner who is developmentally at a critical age, or a student who is on track to graduate this spring, we want to find a way, closure or not, for students to receive the education they need and deserve so they are ready for what's next. This is why the governor announced today that we will be issuing a statewide closure of schools by Wednesday, March 18th through March 27th, so districts and charter schools can create plans to equitably distribute distance learning to their students should there be a need for a long-term closure. This is a precautionary measure so that our educators are prepared should we need to close schools statewide for longer. The Minnesota Department of Education is defining distance learning to mean that a student receives a daily interaction with their licensed teachers and receives appropriate, equitable educational materials. At the end of this short-term closure, which we acknowledge is also during Minnesota's spring break season, the situation is going to be reevaluated on a daily and even an hourly basis. And at this point, our plan after the time that our educators will use to plan for distance learning, our plan is to resume instruction on March 30th. After these 8 days of planning, while there will be no universal instruction or care delivered to students during this 2-week planning period, we are making arrangements to accommodate elementary school-aged childcare for parents who are first responders or healthcare workers, so they can continue to support our communities in their professional roles. I am stressing to use this time, this whole time, to plan. We are not accommodating a couple snow days. We are planning for the potential of weeks of distance learning delivery. MDE has issued guidance to school districts and charter schools for how they will be thoughtful about their planning, offering careful consideration for students in a variety of areas, including students receiving special education and students who rely on school meals for nutrition. None of this guidance is asking our education staff to put themselves at risk if they are a member of a vulnerable population as defined by the Minnesota Department of Health. They need to stay home. I know this is a lot to ask of our districts and our charter schools. And I also know that there is no one who can solve a problem like our educators can. I have such faith in our education community to come up with really creative ways of how we administer these services equitably, like using school buses to deliver school meals or helping and distribute learning plans. And I also want to be very clear to districts and charter schools that the governor, lieutenant governor, and I expect schools to continue paying their hourly workers, like paraprofessionals, nutrition staff, and school bus drivers, and that they are incorporated into your distance learning plans. I'll repeat again. The governor, lieutenant governor, and I expect schools to continue to pay their hourly workers, like paraprofessionals, nutrition staff, and school bus drivers, and that they are incorporated into our state's distance learning plans. We are also very aware of the impacts this type of closure would have on our healthcare workforce, many of whom have school-age children. School districts should continue to care for families of emergency workers, providers of healthcare, emergency medical services, and other critical services such as law enforcement, corrections workers, and firefighters, who are critical to the state's response to COVID-19. This care is not required during previously scheduled school breaks. Right thing to do for Minnesota, for the safety of our students, and we are grateful for this critical call to action. Together, we can do this. School districts will handle the verification of students, which may include securing a letter from an employer or showing an employment badge. The governor and I are also encouraging school districts to provide extended care before and after school hours to the students of emergency workers as possible. Educators are true public servants, and setting up this care for the children of healthcare workers is the right thing to do for all of Minnesota. I have spent so many hours in the last few days, in the last few weeks, talking to superintendents, educators, school leaders, and they keep asking me what they can do to help. And there is no problem a group of educators cannot solve, and I know they are willing to make this work. The Minnesota Department of Education also oversees our state's 355 public libraries that are a vital community resource. In the coming days, I will be hosting a conversation with our library leaders to learn how they can safely contribute our efforts to continue learning opportunities for students and their families. To reiterate, districts and charter schools need to close by Wednesday, March 18th. I know some districts and charter schools have announced closures for Monday and Tuesday as well, and that's fine. During this closure, students will not be at school to receive their education. School will only be open for the elementary school-age students of our healthcare workers and our first responders, and for all school staff who are going to be planning for distance learning that works for their school communities. The Department of Education is issuing a school planning kit guidance document at 10 a.m. this morning. And as the governor said, as we look across the country, This is the most comprehensive school planning document in the country. We'd like to thank the superintendents, charter school leaders, and every educator and school staff member in the state for their partnership and their leadership in keeping our students safe and educated during these extraordinary circumstances. One of my favorite quotes is from Fred Rogers, who talks about in uncertain times to look for the helpers. Educators are helpers by their nature, and today we are looking to them. I would now like to introduce my colleague, Deed Commissioner Steve Grove. Thank you very much.
Well, thank you, Commissioner Ricker. Hello, everybody. My name is Steve Grove. I'm the commissioner at Deed, and we just wanted to say that we know this announcement will affect workers and businesses across our state. And just to give you sort of a sense of the scope of this, there are about 650,000 families in Minnesota that have at least one child under the age of 18 in their home. And while we know this will affect all of those families with school-age children, we know that families that will be hit the hardest are those that are living in poverty and do not have access to paid leave during this time. Our best estimate is that there are about 60,000 such families in the state today. So our real priority here is to make sure that we do everything that we can to help the families that are most in need during this challenging time. We believe financial relief for families is going to be necessary based on these closures, so we are closely monitoring the federal legislation that will provide paid leave to parents who look after their kids due to school closings. These provisions provide partial pay replacements for workers who are knocked out of the workforce to take care of their children, and we know it's moving through the Senate this coming week. We'd also urge Minnesota legislatures to do more to look at emergency assistance supplements to the MFIP program to help families most impacted by these closures. And as we stated last Friday, we urge legislators to officially change the statutes around paid leave in our state to allow them to apply in cases of a pandemic, and in cases where workers qualify for UI benefits to adapt our state's unemployment insurance program to pay for that first week of time off and to temporarily exempt employers for charges that are related to, for charges that are related to COVID-19 related layoffs and leaves of absence. We also wanted to take a moment to give some guidance for employers who we know will be affected by these closures. First of all, we just want to encourage all employers to pay special attention during this time to your employees that are parents. We know that employers are already demonstrating extraordinary creativity during this time of crisis, and we ask they continue to be collaborative and creative to help parents navigate school closures. We're just really blessed in this state to have a business community that has a strong civic backbone, that cares about their workers. It's one of the hallmarks of the Minnesota economy, and we are eager to work alongside those businesses to navigate this unprecedented period of time and to make sure that we get this right for workers and for businesses. We would encourage all employers to protect the jobs of parents as they look after their kids. This helps businesses and parents keep these workers connected to their jobs in this tight labor market. We also encourage employers to be flexible about paid leave policies, allowing parents to use whatever type of leave is available to them to cover absences they may incur while looking after their children. And lastly, we will encourage employers to consider flexible staffing solutions. If you are a business that anticipates needing to reduce hours based on these closures, there are ways to do that, and the state can help. We have a shared work program, for example, that offers ways to reduce hours amongst the workforce without letting people go. This program allows you to help pay partial benefits under a plan that you establish with our Minnesota Unemployment Insurance Program, and you can find out more information about that program on our website. Finding creative ways to create flexibility in your staffing solutions during this challenging time will help your workforce better meet the challenges they're facing at home, and also help your businesses recover more quickly as this crisis passes. Lastly, we want to talk a little bit about the business assistance resources that we can offer small businesses in particular who we know will face some of the steepest challenges during this period of time. We want to make sure that all small businesses have access to resources to help them to continue operating as conditions become more challenging. We are preparing at our department to promote the Small Business Administration's Disaster Loan Program. This will be focused on the public through our partners once more guidance has been given from the federal government. This will make loans available to small businesses that are really hit most pressingly by these challenges, and we're already getting some calls from small businesses across the state to hear more guidelines on the program, which we will pass on as soon as the federal government makes those available. Lastly, we'd like to work with our state legislature as well to create appropriations that provide targeted assistance to small businesses who are most impacted by these closures. So the message from us is we know that these challenges will disproportionately affect employees and employers who are smaller and who face greater challenges as it relates to paid leave. We want to do everything we can at our department and in partnership with Minnesota's great business community to weather this time and make it work for both workers and businesses. And with that, I'd like to introduce my colleague, Commissioner Jan Malcolm from the Department of Health.
Good morning, all. 2 days ago, we announced a series of community-level strategies to help slow the spread of novel coronavirus in Minnesota communities. The broad set of recommendations we made then remain in place until further notice. Each one of those policies is designed to make person-to-person transmission less likely by reducing close contact interactions. The full set of recommendations is available on the MDH website, but I want to repeat them right now. It's important to cancel or postpone gatherings with 250 or more people, which includes concerts, conferences, professional and amateur performances, or sporting events. Equally important, to cancel or postpone smaller events, those with less than 250 people, that are held in settings that do not allow social distancing of 6 feet per person. And for those of us who are frequenting bars and restaurants, it's really important to monitor our own behavior to try to achieve social distancing in those places that are open, and we want them to remain open as long as possible, but to do that in a way that is mindful of the importance of social distancing, even in those venues. And it's very important to limit attendance to smaller groups of people. We recommend less than 10 people for meetings or events where the majority of participants are at higher risk for severe illnesses from COVID-19. So that applies to long-term care settings and residential and care settings for people with disabilities, for example. We strongly encourage people who are 70 and older, regardless of their health status, or people of any age who have any of a number of underlying medical conditions that put them at greater risk for having a severe reaction to COVID-19. We know that's a minority of the population, but for people in higher risk groups, it is time now to take this guidance to isolate yourself and to really pay attention to those social distancing recommendations and really to reduce the amount of interaction people at higher risk have with the outside public. There's no doubt that these recommendations mean inconvenience and disruptions for many, but we all need to do our part to slow the spread of COVID-19 and protect the most vulnerable. This also means that schools, child cares, healthcare facilities, and any other employers need to pay attention to this guidance. As has been mentioned by the governor and Commissioner Ricker, the school guidance is absolutely mindful of the fact that educators and child care providers and healthcare workers need to take care of themselves and stay home when they're sick. So we need these particular employers and work settings to be mindful of that and flexible with their staff. Nothing in the governor's order today contravenes any of this health advice. Since our last media briefing, which was just yesterday afternoon, as the governor mentioned, we have confirmed an additional 14 cases of COVID-19, so bringing our statewide current total to 35. While most have an identified source of exposure, with the limitations that we've discussed on testing capacity nationwide, there's just much we don't know about the potential degree of community transmission in Minnesota. As I've said before, it's a matter of when, not if, we will have community spread, and how effectively we can slow down and spread out the growth of this disease in our communities is the key to reducing, most importantly, damage to health for Minnesotans, but also the ripple effects on the healthcare system and our critical infrastructure. This is the right time to implement our community mitigation strategies. As the governor and I both mentioned on Friday, we really stressed this point then, the question of schools' status has been particularly sensitive and important. I want to make it clear that the epidemiological and public health evidence that we talked about on Friday remains the same today. That evidence shows that children and teens are at significantly lower risk from COVID-19. Their infection rates are lower and the severity of their illness is much lower. The CDC has clear guidance about the conditions under which school closures do make sense. One lesson we're really learning out of this is that everyone is looking for more specificity, more clarity in the guidance, and CDC continues to be more and more specific about what school guidance is. There's quite an excellent CDC guidance document available for this. And that guidance clarifies that there is a role for school closure in response to school-based cases of COVID-19 for decontamination and contact tracing, closures of a few weeks at an individual school level, or in response to significant absenteeism of staff and students, which might be a slightly longer period of closure, or as part of a larger community mitigation strategy for jurisdictions which have substantial community spread. We are not there at this point in time. And we're also very aware that school closures have negative impacts on communities, as has been mentioned, especially among those most dependent on the resources attached to schools, like nutrition support. However, we do understand that this epidemiological evidence is only part of a complete set of factors that need to be weighed. With individual schools and school districts taking action in recent days independently, our administration believes that it's most helpful for all involved at this point to suspend in-school teaching and education effective this coming Wednesday, March 18th, through at least March 27th, as Commissioner Ricker and the governor have explained. As school officials use this period to evaluate and prepare for potential mitigation strategies, public health officials will continue to assess the pattern of cases in Minnesota, as the governor has said, day by day and hour by hour, and work with our colleagues at the Department of Education and elsewhere to determine the best approach leading into April. I know the last few days have really ratcheted up our concerns about COVID-19 as we've seen dramatic actions being taken across the nation. It's natural that we should be questioning everything and seeking answers to what's happening and why it's happening. We are mindful of the things that we don't know about COVID-19, but very vigilant and very confident that we will continue to learn and learn quickly about not only what's happening around the country and in our own community, but the most effective ways to work together on mitigation strategies that can achieve that all-important goal, as the governor has said over and over, of slowing down and flattening out that curve. We've said all along, we know we're going to have cases in Minnesota. The key is how we can manage the growth in those number of cases to slow them down and spread them out so that the healthcare system, most importantly, but other critical infrastructure as well, can absorb the impact of this disease, which we are going to need to learn to live with. I really remain hopeful that the success we have seen in stemming the tide of this outbreak in other countries and in some communities in our own country can teach us lessons that we can apply here, as well as lessons we've learned from other outbreaks in Minnesota in recent years. I firmly believe that by working together, we will do everything we can to achieve that outcome of protecting the health and safety of Minnesotans, protecting the ability of our state to get back to functioning as soon as possible. I want to close by repeating again in very clear terms. For everyone, the single most important thing we can do is to stay home when we're sick, whether we think that has anything to do with COVID or not. And this rule really does apply to everyone. We have a strong work culture of toughing it out in Minnesota, and this is not the time to do that. Minnesotans' ability and willingness to follow that guidance is really going to be a big, big factor in determining the ultimate scope of this outbreak. How big and how fast it is depends a lot on us. And of course, we can't say it enough. We hope we get to the point where every Minnesotan can repeat these 4 things about staying home when you're sick, covering your cough and sneezes, washing your hands frequently and well, and avoid touching eyes, nose, and mouth with your hands, and practicing social distancing. All of this information can be found on the MDH website. We have a special page for the coronavirus disease, as well as a public hotline, which we are now staffing 7 a.m. to 7 p.m., 7 days a week. There will be increasing efforts to get out public information on the health guidance as well as the guidance that's just being released for the education system. I just want to end by saying how proud I am to be part of a team like this that works so carefully, so thoughtfully, and so collaboratively to understand the intersection of these issues. Thank you very much. Back to you, Governor.
Thank you, Commissioner Ricker, Grove, and Malcolm. To Minnesotans, I want to reassure you, we are fortunate. We are also thoughtful in that we have one of the most robust public health systems in the country and in the world. We have a collaborative work environment both in the public and in the private sector. As Commissioner Grove says, our businesses consistently step up to make sure that we do the right things together. And now is the time, as all Minnesotans, we come together to take this head on. I can assure you that when decisions are made, they will be made timely and they will be made with decisiveness. What I cannot assure you is that every single variable is there. The testing piece of it is one that we brought up. So when we make these decisions, we are always looking and we will always err on the side of the protection of Minnesotans. I also want to make note the complexity of a decision of closing schools. When you've heard us talking about this and spending the last 48 hours, many folks basically round the clock, collaboratively across the state to think about what those unintended consequences would look like. And my commitment to Minnesotans is every single Minnesotan will be put in a position to be as safe as possible from the spread of COVID-19. All care will be given in the most timely manner and the most effective manner. Every child will be given the opportunity to get a healthy meal during this time. And every child in Minnesota, and every effort will be made to give them the high quality education and focusing on the equity and access issues for every single one of them. We've got work to do. This is going to not be a day or two. This is going to be weeks and months, but with proper planning like we've done here, thinking through the consequences, coming up with an operational strategy with all of the partners, we will do this. Minnesotans have done it before. We're prepared to do it now, and this plan allows that to happen. And I want to close before we take some questions to thank my fellow educators out there. Thank you for the work you do every single day. Thanks for that work in that school that can be challenging in the best of times. But it's right now, there's no group of people that I would want more on the front lines of helping us deal with this than educators across this state. Pull together, do what's right for our children like we do every day, and bring Minnesota through this. With that, the folks up here are glad to answer questions. Yeah, I'm not so certain that we didn't feel it was necessary. I did not think at that time when the first school closings were being announced and we're calling across the country, it appeared to us that these consequences, we were hearing very, very strongly from the healthcare provider community that the workforce issue was paramount. And while you may be solving one problem, you may be exacerbating another, because our fear is if we don't flatten that curve, the overwhelming of our healthcare system. So what we had said at that time, that this was fluid and it would change. After that time, we went out and had hundreds of meetings, continued those on, talked through, and my challenge or my charge to this group was, can we do both? Can we ensure and make school closure work for both the teachers, the students, and the fear of the spread? Even though the health data said it was relatively low, we already know absentee rates were up above 30% in many schools. Parents were starting to look at that. But could we simultaneously ensure the safety of those children, their well-being, their nutritional needs, and provide the care necessary for the first responders in the healthcare system? And until I got that answer, I feel it would be irresponsible. So we went back and came to the conclusion, yes, Minnesota has the resources to be able to do this. Yes, now is the time. As an ever-evolving situation, I think one of the questions I asked myself, was there a scenario during what appears to be the curve of anywhere between 6 to longer weeks that this would happen, would there be a scenario that schools would stay open during that time? And I don't think anyone saw a scenario where that would probably happen because it hasn't happened anywhere else. With that being said, now is the time to us to prepare for that because there are the unintended consequences. We can't leave our children for months without that vital education, especially at a time that's so critical amongst our youngest learners. And so our thinking and over the weekend was to buckle down, to come up with an operational plan. And the thing about this was there isn't a template out there to follow. This is one of the things going forward. This is why every state, in thinking about contingency plans for pandemics or disruptions to the schools, we saw this happen after Katrina in New Orleans, where children scattered and we basically lost a year or more. The implications of that are dramatic. So what changed between Friday and now was the continuation of the planning and drawing together the teams of folks you see up here, our professional educators, the people in the healthcare system, to assure them that this decision would not take them by shock. To announce Friday, like I believe some did, without the consultation with that, I think sets us up to not have this. And I do want to be clear though, we can't let the perfect get in the way of the good on some of these decisions, and it is that fine line between decisive, immediate action, but with a plan that happens afterwards. We know in Minnesota and believe, and I think Commissioner Ricker is humble, but is speaking correctly on this, there is no more comprehensive plan on how to deal with school closure on a statewide level in the country than we have right now. Yeah, and I think maybe this might be Commissioner Grove to talk about. I think you're asking the question about pay and what's going to happen. I'm thankful that it appears like, and our federal partners have been in touch. I've spoken with both the senators and the entire congressional delegation about the work that they're moving forward. I would say at this time and make the case and the stress to our legislature to help us out on this. I'm going to be asking for financial relief for families. You heard about MFIP, maybe making some of the work there, making sure partial pay replacements for workers are in, emergency assistance supplements, and I know maybe Commissioner Grove can talk about this. We are deeply concerned about this, and I think all of us need to understand that, again, the decision on closing schools is going to have a disproportionate effect on those 60,000 plus families who are very much on the edge anyway. We know that there's a significant portion of Minnesota students that get the bulk of their nutrition and food at the school. When that is pulled out, it has immense issues. We're looking at peripheral issues from domestic abuse issues that may rise during this time, working with Department of Public Safety, with mental health counselors. There are numerous ramifications, but the piece about putting the pay back in people's pockets, we're going to be asking for things that I think already happened, suspending evictions, making sure you can't shut off people's cell phones at a time of great unrest. We're going to have great cooperation with our business community, but I mention once again, we want to work with the legislature on this, but there are tools that come with an executive order and an emergency, statewide emergency, that we may use. So, Commissioner, I don't know if you want to add any other thoughts.
Maybe just you, Governor. I think you said it well. I would just add that, we already are talking to businesses that we know are getting creative in the face of these challenges. We're talking to businesses who are finding ways, for example, to open up manufacturing lines in the weekends versus during the week, so that parents could come in on the weekends and do that work. Flexible shifts, flexible hours. Minnesota employers deal with flu outbreaks at other times of the year, for which they've had to think creatively about navigating flexible hours and things. So we think employers will do some creative things there that we may not have even thought of, but we're going to continue to talk to them in close consultation in the coming weeks. And again, I think we would urge employers to protect the jobs of workers. If you can decrease hours versus letting people go, that is always better. And there's ways that the state can help if you do that through our unemployment insurance program. And so we encourage employers to reach out if you find yourself in that position.
Yes, and these are the steps, as we said, we move through these steps during a pandemic. I believe you saw in France and potentially Spain yesterday that those are some of the steps that would be taken. I think what we're trying to look at is if you can get mitigation on the front end, and Commissioner Malcolm and I have had numerous conversations and looking at a lot of data. There were Singapore and Hong Kong being the two examples where in Singapore they did not close schools, in Hong Kong they did. They got some of the same results. We're looking at this because a lot of this is new territory. That, and I just have to be candid, that may become an option at this point in time, and I think we're all prepared for it will happen sooner rather than later. The community transmission will move us out of that. That is absolutely apparent to all of us. But we are thinking about that. I think individual. I saw yesterday concert venues, First Avenue and others made that decision to move. I think you're going to see businesses do that, but I think this is a really important part Commissioner Grove is talking about. We want to make that decision for them, not to be a decision of protecting public health or going bankrupt and losing your business. We want them to be able to weather this, stay in business, and come out the other end. And that very well could be the next steps. And I think for everybody in here, you recognize this, how day to day changes our reality. And we know that the decision we just made here has a magnitude of effects that is very big. So by the time we gather again, potentially for a news conference tomorrow or Tuesday, we're prepared to think about that. And that's, again, but doing it with the foresight necessary to plan, doing it with all the people involved at the table. So I do not have a clarification of that yet because the cases, the 14 that just came out, I have not got a breakdown on them. I just have to be candid with you. I would be surprised if it wouldn't be because of the pace we've seen in other places. I don't want to make news on that out of place for MDH. That is me seeing how this is going. That will be to you as quickly as possible as they finish. That run just finished, and I'm getting almost up minute to minute. We're trying to get you as much information, but also being cognizant of not putting out false information. So if you can take that, I'm leaning in as much as I can. I don't have a confirmation on that it is. Is that fair to say, Commissioner? Okay. But I think we'll see it. Yes, ma'am. Yeah, that's a good question. I'll let the Commissioner.
And I think this kind of goes to the prior question as well. We have said it'd be naive of us to think we're not going to have community spread, but it does matter, like how distributed it is, how many cases. So of the now up to 35 cases we've seen, there are not, major clusters anywhere. The demographics are spread out. I'm happy to say that of the 35, and again, I have to caveat that I don't have full information on this latest run, but we've had very few illnesses that were severe enough for hospitalization. Sadly, one person is critically ill and I believe remains in the hospital, but the other individual who was hospitalized was discharged to home to recover. So that's the better news in the scenario, is that of the cases we have, we're closely watching where they are and are there any connections. We're not yet seeing large numbers of cases popping up in any one concentrated area. We're tracing very carefully what are for most of these cases, it's been a pretty clear epidemiological link to a source of transmission. So it's when we start to see significant numbers of cases with routes of exposure that can't be pretty readily explained that we start to say this is community spread of a more significant nature. CDC distinguishes between mild to moderate community spread and widespread transmission. And that's what we'll be keeping our eyes on, is as these numbers grow, as we expect them to, what's the nature of the cases and the spread will be very critical to informing the next steps that we want to take in community mitigation.
I want to thank you for your question. That is one of the reasons we were so careful about creating some planning time for our educators to determine what an equitable distance learning plan would look like for their school communities. The guidance that we are giving districts this planning kit is to create that equitable distance learning plan for all students. It will be locally developed. If a school has an e-learning plan and they are assuring that all students have equitable access to that plan, that fits our guidance. But our expectation is that each school district will take this time to plan for an equitable distance learning plan.
Before I take another question, I'm going to have superintendent step up maybe, and if some of you are curious about this, how this will look and how it works on the ground.
Does anyone have a specific question? Sure. Correct. Sure, and I'd like to just add, again, I'm Christine Tucci-Osorio. I'm the North St. Paul Maplewood Oakdale School District. I also have my union leader with me, Rory Sanders. And we've actually been working around the clock with the commissioner and many others to try to come up with some ways that this could work. And I've also been in communication with many superintendents as well. The thing about this is that this next couple of weeks are really about planning. They're planning time without students in the building so that we can actually get really organized about how this is all going to work. So on one level, we're working with all of our teacher teams to finalize and really get specific about what our distance learning plans, our e-learning plans are going to look like for us. In my particular district, we do have the capacity to be one-to-one devices, e-learning for our secondary students. But distance learning for us will look quite different for elementary age students. And we are working through what that's going to look like for us. There's a couple different options out there that have been done in some different ways that people do check-ins, and they do kind of different ways of checking in and getting families connected in with teachers on a day-to-day basis, but they may not have a device in their hands every day. So we're going to take a little bit of time to inventory with families what resources out there, what resources do we have. This time is golden for us to be able to plan that in a really thoughtful and meaningful way. I want to add that we're also using this planning time not just for licensed teachers, but for all groups of employees in our system. For example, working alongside our bus drivers, we're going to be working through what are the scenarios that we're going to be facing when students do return to school. Because again, we are closing our doors for planning time right now, not because of an outbreak in our schools per se. So when students do come back, in the event that we are reopening our doors as planned, we want to have different routines in place. How do we wipe down and sanitize our buses in between every run of the day? How do we maximize, as much as we can, sanitary environments? With paraprofessionals and others that are working with students, especially different groups of students, what are we doing to sanitize manipulatives in the classrooms between use? What are our hand washing routines? With our custodial staff, how do we do our best to have completely different routines for sanitizing spaces in our buildings? What are we going to do differently for routines in our lunchrooms? To do things differently, do we need to stagger our lunch shifts so that we can maybe spread people out a little differently to avoid the density of people being in one space at the same time? Are there some different ways we can look at everything? And every single employee group has work to do. And we've actually started Google Docs of how we might organize our work over the next few days and couple of weeks. To how might we really rethink everything that we do? And even staff meetings. We're going to be working with our principals right now. If you're going to hold a staff meeting to talk about all this on Monday morning or Tuesday morning, Wednesday morning, how might you work things differently? For example, if you're a high school principal who normally meets with your staff in a lecture hall, maybe you would take that staff meeting to an auditorium where your staff can really spread out and not be sitting right next to each other. Or how might you use virtual meetings like Google Hangouts or Zoom so that you can talk to your staff in their own classrooms without bringing them together in one gathering space? In an elementary school, same thing. Or maybe you would bring your groups of staff to a cafeteria so they can spread out around that wide open space, have a conversation, but not be talking to each other elbow to elbow. Even inside of our working environments, how do we rethink absolutely everything we do to maximize the safety? We're also going to be using this time to take an inventory for some of our districts that have been on spring break already. We've had students and family and staff who've traveled. We want to take an inventory about who already might be on a 14-day self-quarantine because they happen to have gone to Europe and the rules changed during the time they were gone. How many might be affected by that absenteeism? And then how many of our own staff might be in that medically compromised, immune compromised category that might have to be absent more? We want to kind of get an assessment of how many of our own employees, because we need to take care of our own employees as well, might fit that bill. So we can kind of map out all of our resources and then figure out how we might do our best job of providing childcare and services for all of our emergency workers, medical professionals in the field, so they can stay in school and be serviced while we continue to support our community in that regard. So lots of work to do. I don't believe so. I think our goal, if I can speak to, Commissioner Ricker could maybe speak to this, but my understanding is we're going to be working to deliver education during this time. If we plan for distance learning, the plan is that we actually are working on Minnesota state standards in all of the content areas, and that our plan, and that's why our teachers are going to be working together actually to work on how do we actually teach to all of these standards and work in this regard throughout the whole time. If we have to go to distance learning plans, this is why we are going to be doing this work together. I will just add too that I have a feeling, the optimist in me is that we're going to learn to do so many things better. We're going to be tapping some resources we didn't realize we had and maximizing some things that we weren't doing as well as we could have been before in through all this. I think we're going to find some real innovation that's going to grow out of this work together.
Thank you, Superintendent. Yeah, well, I certainly understand the human nature of a time like this of folks stocking up, but I would ask folks to be judicious about this, to understand some folks don't have the capacity to be able to stock up, and they're looking for just enough to get through the day. I think working together with suppliers and in that supply chain of making sure things are available, but I think it goes back to my opening. This is going to require us to socially interact differently. And that doesn't necessarily, and I appreciate the superintendent's optimism on this, it doesn't necessarily mean social distancing and we all become introverts. It means understanding that maybe you don't need to buy 3 of the 36 jumbo rolls of Charmin because the person next to you at least needs to get some of that. And I would just ask for us to start thinking about ways that we can make it a little bit easier on everyone. So those are going to be things that we have to think about. Certainly, plans will be in place, and we hope we never get to that point of what happens if the state needs to be providing some of these sources out there to people. I do certainly, again, want to reiterate our friends at things like Second Harvest Heartland, deeply concerned about what's going to happen on the need for food at food shelves. Minnesotans consistently rank as the most generous people, and that is not misplaced pride. That is an objective measure of our charitable side of giving and things that we donate. Now is the time to step that very Minnesotan attribute up, start getting out there and giving some of those things, thinking about this. If there is no toilet paper in the grocery store, there certainly isn't any at the food shelf, and some people have no opportunity to go to the grocery store. So I think that's my message is we have to start thinking, but I want to acknowledge, I understand that basic human nature. The thing I can reassure people of is we're going to continue on and shoulder on in a way that is smart, protects the people, but these educators are up here. This is the situation. Closing schools isn't like flipping a switch and everybody go home and that's the end of it. This is transitioning to a different way of delivering education because that is equally important. And I'd like to, if I could, and I'll be glad to take questions after this, I'd like to bring Commissioner Grove up here and talk a little bit about the issue of childcare in general, home-based childcare settings and childcare settings.
Thank you, Governor. I did just want to underscore something from the governor's executive order as it relates to childcare for workers. I know many parents are thinking about this right now as they hear us talk about these closures. I myself am a parent of 2 3-year-old twins that we send to childcare every day. I want to be very clear, the governor is not asking childcare centers to close. He's asking them to remain open wherever possible. Childcare is a critical support for our workforce, particularly given the challenges we face today. The reason for that is that the kind of guidance that you hear from Commissioner Malcolm in the Department of Health really applies to these larger settings, and childcare centers are very different in that sense. They are smaller settings. Also, this is a 2-week planning period. right? And so the planning period is for schools who are going to need to offer distance learning. Childcare centers are not going to be needing to offer distance learning if further guidance is issued for them to close down. So we do urge childcare centers to stay open. We realize, of course, that if there's any health concerns with workers at childcare centers that match the restrictions and guidance that has come from the Department of Health, that they, of course, should go home. But if you're able to stay open, given the guidance you've gotten from health, please do. Now more than ever, we need you to come together and help us ensure that workers can navigate this difficult time. We're certainly considering all kinds of options as it relates to how childcare could unfold. I think that the first order of business, as the governor said, was to ensure that we can provide childcare for those emergency first responders, for those healthcare workers, and we believe we can do that through the school system during this planning period. But part of this planning period will involve us thinking through other potential levers we need to pull to provide emergency assistance, and you'll hear more from us on that as it becomes relevant.
Our first priority is to plan for extended distance learning. And we do have in our, as we've been thinking about our school planning kit, we do address assessment. We have been in communication, reading through the guidance from the Federal Department of Education. We've also been in communication with the International Baccalaureate, Advanced Placement, testing companies to also determine what their plans are. They are creating their own guidance documents around that. And so this is one example of how this is going to be a living document. As we continue to get more information, we're going to continue to share it as we look to the federal government, as we look to other national tests that our students were hoping to sit for, we're going to make sure that we get that information. We share it with our school communities as we get it. Thank you. Right. So the governor and Lieutenant Governor and I are clear that it is by Wednesday. And so we understand that some of our school communities have already made decisions about Monday and Tuesday, and we want to honor those decisions. For some of our school communities, they are looking at opportunities for school nurses to make sure that any medications that they're holding for students get returned. They're making sure that they are collecting any materials from students or distributing materials for students to take home. And so we wanted to say that by Wednesday, we expect every school to be closed and to give that flexibility Monday and Tuesday in case local school communities have needs they need to address.
Thank you, Commissioner. I would follow up on that, Brianna, that this is a good question. It's one that my team would tell you that I extensively discussed with them. And I think the Commissioner's point on this in the preparation is exactly right. But I think it's important for Minnesotans to recognize the health advice that's coming and the health advice that was given on Friday hasn't perceptively changed about the risk to schools. And this is just an orderly transition to what distance learning will look like instead of just the cutoff date, because I think I go back to that point again. The assessment is that at some point in time, schools will close, and there may be the time schools would need to close because we would be seeing massive community spread. That is not the case. We do not have that, and this just allows them, and it allows some of those things. It is as simple as that. Some kids need to get back into school on Monday to get things they need. Some kids can go back and the schools are able to hand out things to get them started or where they're at. And I think it just allows what we believe in is the leaders in the local schools to make some of these decisions. So it's a really good question, but I think that makes it more orderly. The order says, students, that it will be closed by Wednesday.
Governor, there are people, I know a lot of people who work for office, understand today's recommendation is feasible, good policy. As I understand, unless you're
It could happen, and we're seeing it. I think Dave's question is well taken. I want to just reiterate, we're not blind to some of the contradictions and the gray areas of this. There is no plan for this. There has never been in the country a plan for a statewide of the number of students transitioning to distant learnings ever. So it's a starting out. I think this is a part of that, of using the best judgment. We understood the contradiction on Friday of saying, keep, the social distancing. And I heard teachers said, well, unless my classroom's going to magically get 3 times bigger, that is not possible. We understand some of this. We're asking folks where they can, but once again, many times folks who can distance learning are in jobs where they're in a place where if they're taking home, they're commuting, they're in finance or whatever, maybe a little more secure in their finances. And I think Commissioner Grove bringing this up, businesses that usually wouldn't manufacture Friday, Saturday, and Sunday, or Friday night, Saturday, and Sunday, are switching from that so that the parents would be home Monday, Tuesday, and Wednesday. And those are the types of things that are happening. But I think it's to keep in mind, if this follows the pace that it's placed some places, the need to close those is apparent. And I think all of us understand the economic impacts. Those are not just dollars. Those will have real world impacts on people's health, well-being, and safety if they're not able to get it. So I ask you to bear with us on this as we're seeing across the country. I think the best we can do is plan with as many contingencies as possible, but to understand, I think it's altogether possible. We'll be back here and some of these things will change. And we have had this conversation. No state has figured out how to provide child care for the healthcare workers in a real sustainable manner. So I want to be clear about that. But what I asked my team to do is come up with a plan to do this that hasn't been done before. And that's why I'm going to give a thank you again to our educators across the state stepped up and said, we want to be part of that solution. Let us help figure that out. So that's why this is a unique, if people thought it was going to be the doors were all locked and no one's there, it's more complex.
I'm sorry, maybe my question was too broad. Specifically to employers, should they tell their workers, don't come to work?
Jen or Steve? Yeah.
Yeah, Dave, I think that has been the guidance in the Department of Health, is if it's feasible, you should telework. And to the governor's point, it is not feasible for many professions, and it's generally more feasible for professions for people who are more well off or in the professional sector. So that is the guidance, to telework if feasible. And when we talk to businesses that employ lower wage workers and manufacturers, we know they'll be disproportionately hit on this. So will small businesses. And so going back to some of our guidance for small business, that's why we're targeting ways that we can support business on those smaller businesses at this time, and kind of to begin to do some triage of which industries are most going to be challenged by the ability to telework and what can we do to help them, and we're going to continue to work on that challenge.
Absolutely. Thank you so much for that question. It is one great example of why it is imperative that we use this time we embrace all of our school employees who are part of this solution. We are going to need our bus drivers to help us figure that out. Not everyone is going to be able to sort of drop their children off or pick them up. And so our bus drivers are going to play a very crucial role in helping to make sure that we can support the elementary school age children of our first responders and our healthcare workers getting to and from school. Yeah. Absolutely. We actually do have an explicit section in our school planning document about nutrition and not only offering some guidance, but also making sure that we are available for any support. And this planning time is critical for determining that. So whether it is a delivery of school meals packaged, boxed or bagged by our school bus drivers, perhaps, whether they are community distribution hubs, perhaps setting up places that are also open and then staggering times for students and families to come pick them up. Our school leaders are actually already discussing some really creative ways of with our school nutrition workers to how to package that food and how to make sure it's packaged in a healthy, safe way, right? And then talking with our transportation workers to make sure that we can determine how that gets distributed. Talking with other school, faculty, school staff to find those connections in the community if we're going to have like hubs and distribution centers. That's why it's actually, this is an all hands on deck moment. We need every school staff worker to help us think through all of the decisions, and some of, many of which we have outlined in this document. Yeah. That's right. That's right. Thank you for asking. So that's right. Our teachers and our paraprofessionals and our school principals and assistant principals are incredibly important to be able to deliver the sort of care to our healthcare workers and our first responders. And so we are asking our employers to also exhibit that same sort of flexibility around care for the school-aged children of our school staff as well. That could also look like some flexibility in staffing for them. And these are decisions that can be addressed, sometimes on a school-by-school basis, sometimes on a district-wide basis, to make sure that our school staff can be there for our emergency workers and our healthcare workers. We actually have to make sure that our school communities are there for our educators as well.
I want to segue on that too, and just note, if you think about this, I think Commissioner Grove made the note of it. Our Commissioner of Employment, Economic Opportunity has 3-year-old twins. Lieutenant Governor of the state has a 6-year-old daughter. The Governor and the First Lady have a 13-year-old. So we recognize the idea that this is across that. And a key component here, people in this room who are critical about getting out the information, what's going to happen with your kids. How are you going to come to report if that happens? So I again bring that up, that this is uncharted territory, and the thought that's going into this and the help that we're asking from Minnesotans is come together, and with an understanding that this is a living document, as Commissioner Ricker said. Should they stop gathering it?
I think at the present moment, again, with that all-important caveat that things will continue to evaluate whether additional safety precautions make sense. But at the present time, we're really encouraging smaller gatherings to just be mindful of, are there people at higher risk? I would say, certainly if anybody in the home is ill, no, there shouldn't be visiting and play dates going on. Or similarly, if a child is ill, please don't go to a play date in another child's home. Common sense things like that. And just for people to be really mindful and to understand what constitutes someone being at higher risk, and just taking every precaution to protect those smaller gatherings and social distancing. It's really heartening, actually, the number of people who are calling and saying, what about this, what about that? I think we want to encourage interaction where it's safe. And we know that that's an important part of people's well-being, is to be able to still interact with each other. So we're trying to, protect the capacity to do that, but in safer ways.
If I could, everything we're doing is to bend that very famous chart you've now seen from going up like this and overwhelming the healthcare system to staying flat. So that's why this emphasis now, and that's why this type of guidance, I can't stress enough. Being on the cautious side of this, especially at a time where you see the momentum going from 2 to 7 to 14 all the way up, is important. So please, go ahead.
That is part of the guidance that we've encouraged various settings to think about. Does some basic health screening of staff and visitors make sense in that environment? And certainly in some places, like congregate living settings for elderly people or people with in healthcare settings. I mean, that kind of precaution makes sense right now. And we're just encouraging all work settings to think about whether that's feasible and how they would do it.
Yeah, once again, and thank you to all of you. I hope this accommodations here, the questions that were brought up the other day of pushing you into small rooms is absolutely legitimate. I would say to Minnesotans, again, we are well prepared. We thought about this weeks ago. Many of the systems that are in place in Minnesota are resilient enough to handle this. The innovation of the community leaders and the partnership has been unprecedented. And at this point in time, with some cooperation, with following through these plans, we can keep our people safe, we can educate and keep our children safe, and we can come out the other end of this, making sure that our businesses are resilient, strong, and ready to come back. So I ask you over the coming weeks, join together with your neighbors. Let's show them what Minnesota can do. Thank you.